Canada's Deputy Chief Public Health Officer, as you know, just reiterated during a press conference that if provinces decided to delay the second dose, it recommends not more than 42 days. They say they don't have the data that proves the dose is still effective after that 42-day mark. So what data do you have that they don't, that shows the first dose is still effective up to 90 days?
Yeah. Well, what we have is the experience working with many vaccines through time, and with the experience of immunologists that show that immunity is not something that is on or off and that it stops after 42 days. This is something which is much more gradual than that. So it's possible that there would be a decrease after a certain time after immunization. We are monitoring that. We know that delaying from 42 days to 90 days is a short period of time. And if there's anything that we see that indicates that certain people would have decreased immunity, we would give immediately the second dose. But as long as we have good protection for the population with the first dose, up to 90 days, we will immunize as much people that are very vulnerable to disease and hospitalization and death in certain cases. So we think that it's really worthwhile in our situation. It would be different if we would have a very low number of people infected like what we have in Eastern Canada. But this is not the case in the province here.
With your discussions with Pfizer on this extending the delay for the second dose up to 90 days, what was your sense on whether or not how much they approved this plan?
As I said, and Richard has said the same thing, but he can comment again. We didn't ask the permission. We informed them that it was a recommendation that based on our experience that we were comfortable doing in the circumstances. They know the discussion that we have with the feds, with the CCNE. And again, Dr. Arruda was very clear yesterday when he discussed those instances, and everybody accepted on that committee. They understand that the situation in each province can command or can dictate a different approach to take into account the clientele that we have. And in our case, given the absolute number that we have and those vulnerables that we need to take care very quickly, I think that that was just a good relationship that we have with the manufacturer to inform them of the strategy. And I think that Dr. Arruda did the right thing, and we appreciate the collaboration that we have with Pfizer.